Welcome to the Occupational English Test, also known as OET. In this training video, I shall be running you through the Speaking Sub test for physiotherapists. So let's begin. The test format is as follows. You will be given 20 minutes. You need to talk to the interlocutor for 5 minutes. This is the warm-up session where you will be asked personal questions. Following this, you will be given a role play card and 2 to 3 minutes for preparation. Once you're done with your preparation, your role play will commence. This will go on for about 5 minutes. Once you are done, you will be given a second role play card and the same procedure will be repeated. So basically, you will be given 2 role plays specific to your healthcare profession. This session is recorded and scored by 2 different examiners. This test is a face-to-face examination. It will be between the interlocutor and you. The interlocutor will play the role of the patient or the carer, while you will play the role specific to your healthcare profession. Now, this is how the speaking is assessed in OET 2.0. These are the total marks scored by you divided by 39, which is a result of 24 plus 15 into 500. Whatever score you get is then converted into the grade. On this side, you have your linguistic criteria. The first one is intelligibility, which basically means speaking with clarity in a way that is understood by the other person. The next criteria is fluency, speaking without pausing too much or using too many fillers. The third criteria is appropriateness of language, which basically means that depending on the kind of task you are given on the card, you must use language according to that. And finally, resource of grammar and expression, which include all the important components of grammar, like sentence construction, proper usage of articles, tenses, proper words and phrases, etc. This is a total of 24 marks. For each criteria, you get 6 marks. On this side, you have the clinical communication criteria. The first point is relationship building. For this, you've got 3 marks. In fact, you've got 3 marks for all of these criteria. Relationship building talks about how you interact with the patient. Are you making the patient feel comfortable? What kind of words are you using? So all of these components are covered there. The next one is understanding and incorporating the patient's perspective. When you are doing the role play, you will be expected to use this particular aspect as well, instead of just assuming and suggesting or judging the patient. The next criteria is providing a structure. You must follow the structure given in the role play card. At the same time, you must tailor your responses based on the structure. Information gathering refers to how you get the information from the patient and what kind of information. And information giving refers to the solutions you will be providing to the patient or the carer. This comes up to a total of 15 marks. Let us look at the description of this type of question. You are given 1 role play card at a time. You will not be given the interlocutor's role play card, so you don't know what the interlocutor is going to say. You can only guess based on your card. The interlocutor's card will include information that is not included in your role play card. It gives you a good idea of the outline of the conversation. The role play cards will inform you of the key details about the patient. They also consist of the reasons for the patient's appointment. You need to take all of these pieces of information into consideration and plan your approach accordingly. Now, here are some strategies to answer this type of question. First, you must understand that this tests a real patient and health professional interaction scenario. This test is basically looking at the communication aspect and not specifically your medical knowledge. When you get the card, analyze the type of information given. If you have doubts, you must ask or clarify these doubts before beginning your 3 minutes prep time. Try not to memorize long answers. People often do that. You might not necessarily get the same card. Establishing a relationship with the patient, in this case the interlocutor who is posing as the patient, is very, very important. Make sure you ask for relevant information and do not include anything that is unnecessary, as this will just take up a lot of time and you will be completely off topic. Since this is the speaking test, there are some major factors that you must keep in mind. The first one is pronunciation. You must speak with correct pronunciation. You don't need to imitate a native accent, but your own accent must be very clear and pronounced. There should not be a hint of mother tongue influence. At the same time, when you're interacting with the patient, you shouldn't think about what you're going to say next, as you've already been given 3 minutes of preparation time. So make sure you use less fillers like or pause for a long time. Make sure you include all of the information, especially those given in the bullet points. If required, during the prep time, make notes on how you're going to ask these questions. Keep the context in mind, and by this I mean the setting. If you feel that certain keywords and phrases are important, or you can underline them and speaking, refer to them. Using a wide variety of vocabulary will give you an edge and increase your score in the linguistic criteria. Don't just stick to very simple phrases. Try to elaborate your question. Intonation and voice modulation is extremely important. Intonation basically is how your voice rises and which parts you're stressing on, how you're saying it. Voice modulation is again connected to the rise and fall. Like when you start a sentence, you speak with a rising tone. When you're ending, you speak with a falling tone. The ideas and examples given in your role play card should be said in full and complete and proper sentences, not in short bursts of phrases. Most importantly, remember to be confident and smile. Make eye contact with the examiner. Of course, you don't have to stare intensely or continuously, but make sure that you do not look distracted or at the walls or the tables or any other props present in the room. Take charge of the conversation and lead the conversation. This is practice 1. Now this is practice 1. Based on the strategy discussed earlier, you must prepare for the role play. Now this, as you see, is the interlocutor's card. This is the setting or the scenario in which you will be interacting with the interlocutor, who will be posing as a patient. The interlocutor's role is defined here, and the task that the interlocutor will be carrying out is mentioned here. You must note that you will not be having any sort of access to the interlocutor's card, so you have no way of knowing what he or she is going to be speaking about. So when you're practicing in the class, the trainer will play this role while you will do your candidate's role. If you're practicing with a speaking partner, you can definitely go ahead and give this card to your partner. Now this is practice 1. This is the physiotherapist's card which you will be using. As you can see, this is the setting. This is your hospital rehabilitation unit. Now this is a description of the patient who is going to come and see you. And this is your task. You have to speak on the basis of this particular task. There are several points included here. Do not read them as they are. You will need to tailor your response based on the interlocutor who is posing as a patient. So the interlocutor's response as well. Next comes your practice 2. Similarly, using the strategies given before, you will use these cards to practice. The trainer will practice with you in the class scenario, whether it is online or offline. This is their particular card. So this is your physiotherapist's card. Using the same strategies, you need to practice. Once again, make sure that you don't just read the task as given. Use the right words and phrases. Now, in order to understand what exactly you need to use, let's move on to the next section. So here are some OET speaking phrases that will enable you to enhance your fluency. For example, let's take the first point. If you're starting a conversation, you could say, "Hello, I'm Dr. Morris. Can I start with your name?" Now, if you want to keep the conversation moving, you could use the following phrases. "So, please tell me how you fractured your leg." Or, "Are you hurt in any other place?" The third point here is ask questions to get the patient to talk. You could ask questions like, "Do you feel sore?" or "Can you describe the pain to me?" Remember, you must listen to the patient and adjust your language. You are talking to a youngster who has missed his exams because of the accident, or you are talking to an old man suffering from a hip injury. How would your language change? How would the words and intonation change? Here are some more OET speaking phrases, as well as words and meanings. Now, words like abdominal muscle, physical therapy, overexertion, rehabilitation program, subacute, tai chi, flexibility lumbar, all are associated with physiotherapy. So, for example, if you're talking about the muscles of the abdomen, instead of using such a long phrase, you could ask the patient, "Are your abdominal muscles hurting?" Or if a patient comes to you and the condition of their leg or hand which is affected or injured is really terrible, then you can tell them that you need physical therapy. And then you can, when the patient asks you what is physical therapy, you can go ahead and explain. If they are placing too much stress on a particular part or an injured part of the body, then you can say this is you are placing excessive exertion, so you need to refrain from doing that. So here is a suggestion. Pick up these words and start practicing. You can start practicing sentences and then speak them out aloud. Here are some more speaking phrases. You have words like incremental, originate in, behavioral, tilt, neutralize, toned, alleviate, mobility, crunch, and disability. Just like the previous slide which had all of these words, practice, understand the meaning, write down in sentences if required, and speak them out aloud with proper pronunciation. Now here are some techniques. So, first and foremost, you need to understand who the patient is. For this, identify the type of patient, understand the patient's emotions, plan your approach accordingly. Next, interact with the patient. The second thing you need to do is to find out what exactly the problem is. So what do you need to find out? One, the problem. Next, look at your task and rephrase the points into appropriate questions. When you're speaking to the patient, begin with proper opening questions. And when you're finishing, do not finish abruptly. Instead, finish with the proper closed question. The third point is, what do you need to tell the patient on the basis of the information the patient gives you? First, inform the patient about all the necessary information related to the disease or the condition they are in. This will also include tests and course of treatment. Tailor your questions accordingly, and based on the patient's response, you must also respond accordingly. The fourth most important bit is English communication. Communicate confidently. Take control of the interaction. Ensure that you are leading the topic of conversation instead of the other way around. Avoid memorizing from old templates or previously done templates. Ensure that you are maintaining your fluency by avoiding fillers and pauses like and Fifth, the most important point is relationship building. Here, ask permission for uncomfortable topics from the patient. Once the patient tells you what the issue is, do not devalue or criticize them. Show them empathy. Make sure you elicit and explore the patient's concerns. Use the patient's cues to react accordingly. Here are some general speaking tips. First, what you could do is find an English speaking conversation partner and make sure you listen as well as speak. Use a mirror to see how you appear and whether your pronunciation is correct and the placing of the words in the mouth is correct. Record your practice conversation, go back, listen to it, correct the errors. Surround yourself with the English language, practice with music and movies. First without subtitles, then with them. Watch and listen to audio visuals in various accents. Practice reading aloud. If you do this on a regular basis, your speaking and communication will definitely improve. That is the end of this session. Thank you. All the best with your practice.